Hi, my name is Nicole Neal, and I will be talking about autism spectrum disorder. Autism spectrum disorder, otherwise known as ASD, is a neurodevelopmental disability that showcases through differences in behavior, communication, interactions, and learning. The cause of ASD is actually unknown, but several genetic and non-genetic factors have been characterized that, alone or in combination, are implicated in the development of ASD. Continued research focuses on brain development and function, and these studies have identified central nervous system pathologies at gross morphological levels and the cellular level. Additional studies have found the brain structure of young individuals with ASD to contain alterations in the lateral occipital lobe, the pericentral region, the medial temporal lobe, and the basal ganglia. Further differences include brain connectivity alterations found in patients with ASD, and lastly, GI system involvement has been associated with ASD, showcasing in the form of GI dysfunction. We are now going to discuss the clinical manifestations of ASD. Outlining the symptomology and varying clinical manifestations of ASD. The differing and varying clinical symptomologies and manifestations that present for people with ASD can cause challenges in his or her life and can also make it difficult for these symptoms to be differentiated from other psychiatric or behavioral diagnoses. These categories of ASD signs and symptoms include the following. We have social communication and/or interactive behaviors, restrictive and/or repetitive behaviors as well. Lastly, people presenting with ASD have also been found to experience sleep difficulties and possible irritability. The screening and diagnostic methods of ASD remain pretty complicated as patient outcomes and improvement of symptoms showcased highest effectiveness if applied early, yet, as I mentioned, ASD diagnoses are very often delayed, misdiagnosed, or even missed among healthcare professionals because there isn't a specific medical test used to diagnose it. However, with that being said, the American Academy of Pediatrics has recommended universal screening in children between the ages of 18 to 24 months. This screening consists of a developmental questionnaire and checklist based upon research that compares a child's developmental milestones to others of the same age. Additional developmental monitoring is an active and ongoing process of watching a child grow and discussing with the child, assessing for oneself, and also speaking with parents regarding skills and abilities, if those skills and abilities meet developmental milestones in playing, learning, speaking, behaving, and moving. There are varying members of the healthcare team and a child support system that can be involved in this, and this includes everyone from their parents, grandparents, to providers and nurses. Following this, more formal developmental screening involving language, movement, and thinking skills, along with behavior and emotion questions, can be used. A recommendation to a specialist will be initiated for a closer look, and a formal evaluation will then be done. Considering how someone diagnosed with ASD and their families are affected by this for the duration of that child and family's life, teaching and health promotion are not only important but essential to the overall quality of life of the patient, of the parents, and of the family. So the specific types of treatment that can be initiated for patients with ASD include behavioral approaches to treatment. Then further developmental approaches focus on improving specific developmental skills like language skills or even physical skills. Further educational approaches, educational treatments that are given in a classroom setting are necessary. One type of educational approach is called the treatment and education of autistic and related communication handicapped children. And additional social relational approaches of treatment focus on improving social skills and building emotional bonds. There is the option of pharmacological approaches. However, there aren't medications that treat ASD itself, but there are medications that treat co-occurring symptoms. And lastly, there are varying psychological approaches that can help people with ASD cope with concurrent conditions like anxiety, depression, and other mental health issues.
Next, we will discuss the role of advanced practice nurses, specifically focusing on the importance of providing patient and parent education. This is so important because current studies show improvement in patient care and a decrease in parent role giver strain over a long period of time when this education is provided by the healthcare team.
As a Christian nurse, we not only have an ethical obligation to our licensure, but also to our Father himself.
It's especially important for the DNP to provide great care to these patients, particularly because patients diagnosed with autism disorder and other disorders will ultimately, unfortunately, experience discrimination throughout their lives. And one way of providing exceptional care is not only through empathetic, Jesus-centered care, but also through researching the most current evidence-based practice and being sure to utilize that in everyday care and management. The figure on the right is useful because it showcases the varying members of the treatment team that all have a handle in the management of this patient's care.
So as you can see, there's mental health nurses, school nurses, specialist practitioners, social workers, and language and speech therapists.
And this is the final reference page, which also signifies that the presentation is over. Thank you so much for watching.